Okay, step number 1, read the last sentence first. What is the most appropriate antibiotic? Okay, so when we look at this, we know that this is a treatment question, not a diagnosis question. However, it's best to know what you're treating. So she has dysuria, frequency, no systemic symptoms, and she has a positive UA. So this is an acute, uncomplicated cystitis. Normally, we're just looking for a simple first-line antibiotic. However, what makes this question hard is the fact that she has this G6PD deficiency. Now you might be thinking, I don't remember anything about G6PD deficiency, and I have no idea how to answer this question. So, answer choices. Bactrim. It's a sulfa drug, systemic, multi-day therapy. Even without knowing about G6PD, sulfa drugs typically have risks, so we are going to eliminate that one. Ciprofloxacin, broad spectrum. It's very strong for a simple UTI. It's also fluoroquinolone. We know that that's typically overkill for a simple UTI, so we're going to eliminate that one. Nitrofurantoin. It is typically a first-line antibiotic for a simple UTI. But then your brain might be thinking, wait, isn't nitrofurantoin avoided in late pregnancy? Don't remember why, but I do remember some sort of red flag or restriction related to nitrofurantoin. We combine this with the fact that she's got this rare deficiency, and so it might feel unsafe. However, we look at the last option, which is fosfomycin. We know that this does treat a UTI, but otherwise we don't remember much. I can't remember any major complication or contraindication. So if you have these 4 answer choices and there's one that might be the best just because you don't remember any contraindications and this person has a rare deficiency, we're going to go with that one. So I would choose fosfomycin for this one. Did we get it right? Yes. Let's go back and review G6PD deficiency, because that would make answering this question much easier. G6PD is an enzyme that without it, the red blood cells are fragile. Causes oxidative stress and hemolysis and hemolytic anemia. Classic triggers of hemolysis in G6PD are sulfa drugs, nitrofurantoin, aspirin, infections, and even fava beans. So when we go back and we look at this question, we've got this uncomplicated UTI, and our answer choices include Bactrim, which is a sulfa drug. Ciprofloxacin is just too strong for this patient's presentation. Then you have nitrofurantoin, which does cause hemolysis and hemolytic anemia, which is also why you don't use it for late-term pregnancy. And then finally, we have fosfomycin, which is a simple antibiotic used for a UTI, and there is no contraindication for patients with G6PD deficiency. So for this one, now that you know what G6PD deficiency is, it doesn't seem that hard. Let me know below if you got this one right or if you remembered what G6PD deficiency is and the contraindications for it.